As COVID-19 cases, RSV, influenza, and many other viruses, and the rates at which they continue to spread continue to rise across the province of Ontario and across Canada, there is a growing call now to bring back mask mandates in the province of Ontario. Leading that call is Dr. Nili Kaplan-Myrth. She's an Ottawa Carleton District School Board trustee and a family physician. Thanks so much for making the time.
You're very welcome. Good morning, Wyatt.
I think it's fair to say that there has been a lot of debate on an issue of this matter to bring back mask mandates here in Ontario. When you say that you want to bring back mask mandates, is it because of COVID-19? Is it because of RSV influenza? What is, I guess, kind of your pitch to someone who maybe as of this point doesn't see the need or doesn't want to bring back mask mandates?
Yeah, so it is a response to that triple threat of COVID, RSV, and influenza, and it's a response to the Children's Hospital in Ottawa. The Chief of Staff, Dr. Lindy Sampson, sent out a plea to the public to please mask, and even public health has said we should be masking indoors. But the province didn't go far enough. They didn't require it. And as much as I think that most people are good people and most people want to do the right thing, the public has generally been misled to believe that masking is something that should only be required in cases where somebody is themselves vulnerable, and that doesn't make sense because masking is most effective when it's universal. So it means that if a child with asthma or an educator who's immunocompromised is themselves masked, but everybody around them is unmasked, they're still at much higher risk than if everybody masks. So my role as a family doctor is taking care of people all day. My patients of every age, babies, toddlers, preschoolers, kindergartners, school agers, and high school students, adults, many of them essential workers, people who work in grocery stores, people who work in mail delivery or driving buses or construction. They're all at risk, and they shouldn't have to stay home in order to keep themselves safe. They should be able to go out and do the things that they need to do and know that the others around them are taking care of them. So that's why we're asking for a temporary mask requirement back in the Ottawa Carleton District School Board schools to keep all of the students and all the educators safe.
And I mean, I think a lot of people obviously do see something like that, but when you look at how mask mandates have been introduced in the past, they've been temporary measures to kind of curb the spread of COVID-19. And so when you look at if you were to reintroduce a measure like this, I mean, is it a temporary measure? Do you foresee something like this having to now be introduced anytime we see a rise in COVID cases or RSV or the flu? I guess, what's your message to someone who is not necessarily losing hope, but who sees the fact that we might have to bring back mask mandates in Ontario and foresees that as a negative thing?
Yeah, so it is very much a temporary measure, and I think that the message. So there are children as well as adults who have reached out to me and said that they're being bullied or pressured for wearing masks and being told by their teachers or being told by their colleagues, oh, you don't have to wear a mask, you should really take your mask off. And so my message partly to the people who have continued to mask to take care of themselves and to take care of others is thank you for doing that, because it's really important. I think our civic responsibility is to take care of each other. And my message to people who are upset about masks and don't want to be told that they're going to have to wear them forever. Well, you won't have to wear them forever. And this is really, we do need to look at what's going on in our children's hospitals, in our communities, in our schools, to ensure that we're using all the tools that we have. Masks are a really important tool because COVID is airborne, and because these respiratory viruses, influenza and RSV right now are circulating at such high levels that our pediatric intensive care units are not able to manage with the demand for them, and the emergency rooms are crowded and struggling. And as family doctors and pediatricians, we're struggling to keep up with the number of people who are so sick. So it's a temporary measure. And I think the other really important thing is that this was never political. This was never something that, it's not a polarizing issue unless people want to say that masks are bad or masks cause harm. And I mean, just simply, it's not an emotional issue. It's just simple health policy, science, taking care of each other. Masks don't cause harm. There are some people that have disabilities or specific reasons that they cannot wear a mask, and we acknowledge that. And as part of our recommend, like the motion that I put forward to the Board of Education to require masks, I've written into that people with disabilities will be exempt from that requirement. And we're going to expand that exemption to say that anybody who finds it a hardship, and I hope that will be a very small number of people, because for most people it isn't a hardship. But for people who do find that wearing a mask in any way interferes with their ability to function, we're not looking to be punitive. We're not looking to suspend any students. We're not looking to discipline any staff. It's really about just if we can get 90% of people indoors wearing masks again, and there are 10% who don't, it's still a huge improvement. And as Dr. Sampson at CHEO said, like, everybody who masks, that does make a difference. So that's our goal. And I'm very sad. I'm disheartened that there is hateful kind of rhetoric around this, that people are equating throwing away masks as some form of freedom. It's really not. It's not okay to let our most vulnerable populations get sick when there's something that we can do to help them.
And just before we conclude, Doctor, I do want to ask you, I mean, the message that I'm hearing from a lot of people is they got vaccinated with the hope that, then they wouldn't have to go back to wearing a mask. What do you say to those people who see vaccination as a measure that was supposed to curb the spread of COVID, but now here we are having to bring back mask mandates?
Yeah. So, all along we've been saying that this is a layered approach, that it's really important to get all the vaccines that you're eligible for, because that does help to prevent serious illness and death. Now, some of the people who are ending up in hospital, our youngest population, those patients who are most likely to end up in the intensive care unit, many of them were too young for the vaccine, so they didn't get their doses. Also, a lot of people didn't give their children all the doses of the COVID vaccine that they should. And our immunocompromised patients are at higher risk. Our patients with diabetes are at higher risk. So there are so many people who did step up, and they got their COVID vaccine and they've gotten their flu shots, and that's really important. But it's one measure, and the wearing of masks is another measure. And we should have had supports in place to give people adequate sick leave. We shouldn't be pushing people to go back to work and back to school and back to play when they are sick and contagious. So that's a policy failure at a provincial level. We should have also improved ventilation in schools and in workplaces. We should have HEPA filters running. There are so many ways that we can address this. So it's not that, and we never said that getting a vaccine would prevent getting a COVID vaccine would prevent all transmission of COVID. We said it would help to prevent the most severe illness, hospitalization, and death. And that has actually rung true. That has been very effective in looking around. I, as a family doctor, I see patients every single day. Many of those patients end up being COVID positive, or they have other viruses, but because they're masked and I'm masked, and because I've had my vaccine, I'm still here and alive, and most of my colleagues are. But at the beginning of the pandemic, what we were seeing was people dying, like, by thousands and thousands. So we did achieve what we wanted in terms of getting vaccines out there. And I do strongly encourage people to, if they're eligible, 12 and over, to get their bivalent booster, and to make sure that their children, as soon as possible, have had all the doses of COVID vaccine as well as the influenza vaccine.
And I just want to squeeze in one last question. When you look at, I guess, the viewpoints of a lot of Ontarians and a lot of people, maybe some of even whom you would represent as their school board trustee, they don't necessarily see the pandemic as over, but they do see it as having reached, I guess, a better point than we've been at over the course of the past couple of months, the past couple of years. So, I mean, when that is the viewpoint of a lot of people, and when so many people and even some medical professionals whom are advising government have said it was okay to pull back on some of these COVID measures, why do we need to bring back mask mandates then?
So some of the messaging around COVID being over was a political wish to appease the public, to tell them, okay, fine, you can go back to the gym, you can go back to restaurants, you can go back to all the things that you want to do, and that was premature because COVID really never ended. Sometimes it's hard for people to understand that when a disease becomes endemic, when it's here to stay, it doesn't mean that we don't stop doing all the things we can to prevent it. So for example, lice is endemic, right? But we don't want all the kids to go to school with lice. We check for lice and we send children home and ask them to treat for lice. And chicken pox, when I was a child, we all got chicken pox, but now it doesn't happen. And it doesn't happen partly because we immunize children against chickenpox when they're 15 months old. And it also doesn't happen because if a child were to go to school with chickenpox, we would send them home immediately and we would notify the whole class that somebody with chickenpox was present, right? So we need to help people to understand that COVID is still in our community at very high rates. Like if you look at public health dashboards to look at rates of COVID, they're very high. And unfortunately, we don't test anymore. We're not even really looking at wastewater levels anymore. So the misperception that COVID isn't there is because we're not sharing that data. We're not gathering that data. We're not reporting on outbreaks in schools. One of the schools that I am now responsible for had a respiratory outbreak for more than a month, but nobody was told what it was. Nobody was told to isolate. They held a Remembrance Day assembly where I think 80% of the student population ended up sick, but nothing was done, right? So that's really our province making political decisions about not wanting to tell people what's going on, because it's sort of like ignorance is bliss, but ignorance isn't bliss. Ignorance means that we now have children's hospitals overflowing and pediatricians across the country saying, please put on masks and please do everything that you can. So by saying COVID is over, it meant that, the government could say, okay, everybody go back to work and we're not going to let you have any sick leave and we're not going to enforce any health policies anymore. And that's pandering to a small number of people who really pushed for that, and it's not in the best interest of the public. So sadly, COVID is still here, and we do still need to be aware that all those precautions should be in place, even if our province isn't mandating them. And putting the pressure on the individual offloads it from the government, gets them off the hook. But I mean, ultimately, then we end up with a situation that we're in, which is really not okay.